Hello, Facebook friends. It's Carla, your online doctor, with today's Live in 5. Today is Wednesday, June 26th. It is 5:02 p.m. Sorry, my watch is giving me my heart rate instead of the time. So it is 5:02 p.m. All right. So we were talking yesterday a little bit about information from Dr. Heather Paulson, and I want to continue a little bit more of that because there's so much more she had to share. So she says ways to reduce toxicity during chemotherapy to protect your kidneys is obviously paramount. I mentioned some options yesterday. Interestingly, she talks about adding melatonin to help prevent bone marrow suppression. Hi, Cecilia. Which I thought was kind of interesting because I'd never really heard it talked about that way. So that's just something to keep in mind if you are currently receiving chemotherapy, to talk to your oncologist about. Hey, Tina. About adding some melatonin. She talks about drugs like adriamycin, which have a propensity to damage the heart. She recommends supplementing with L-carnitine, which is an amino acid, very simple, and CoQ10, which I've talked about before. Now, L-carnitine helps reduce side effects on the heart, but also helps us make energy, which can help us with fatigue associated with chemotherapy treatments. Okay, anybody, if you've ever been with anybody or have received chemo yourself, you know they're dragging. So what a nice simple way to get your energy back by just adding a little amino acid to your routine. Now, Goji Berries were also shown to improve cardiac function during the chemotherapy treatment. I personally take a supplement every day that is chock full of Goji Berries, and it gives you a ton of energy. So that's just another bonus right there. Okay, she goes into talking about methotrexate, which is not only a chemotherapy drug, but it's also used for a lot of autoimmune diseases such as rheumatoid arthritis. Oftentimes people develop what's called mucositis, or issues with cracking or drying of the oral mucosa, okay, from the medication. Very pleasant side effect, right? It is usually a B6 deficiency problem, and adding 100 to 200 milligrams of B6 daily can help reverse this pretty simply. Okay, again, maybe the oncologists are telling people about this, and maybe not. If they're not realizing it's something as simple as that, they're probably prescribing another medication to treat the side effects. I personally would rather take a vitamin. Okay, L-glutamine is a hot topic in the tumor world, since it can actually increase the effectiveness of chemotherapy, but also it decreases toxicity. Some report that it can actually increase tumor growth, but this is an essential amino acid for proper tissue growth. So when we're deficient, we develop problems with our mucosa, okay, anywhere from the mouth to the anus, okay? Sores in the mouth, and could be simple like that, or anything up to and including diarrhea. So it is very helpful during treatment and can be stopped when symptoms resolve. So it's not something that you have to take all the time. I personally, this glutamine saved my life. When I had my total colectomy years ago, thank you, Dr. Patty Byers. I doubt she's watching, but she put me on glutamine, and it totally resolved the issue I had. I had a short gut syndrome type effect after my surgery and I was pouring fluid out. I had an ileostomy at the time, and I could not keep fluids in. I had a central line, I had a PICC line. They were hydrating me in all different directions. And she put me on an amino acid, and it solved the problem. Okay, simple, but nobody else knew what to do. Okay, I was on Imodium. I was on tincture of opium. I was on so many medications to slow me down. And a simple little amino acid did the trick. Okay, so powerful testimony, but true. Diarrhea is a common problem during chemotherapy and will require different therapies depending on the chemo drug that basically caused it, if you will. I mentioned the L-glutamine already, but activated charcoal is also recommended if you received a different type of chemo drug. Okay, so if you are, a certain drug for colon cancer might require a different treatment than just simple L-glutamine. The activated charcoal may actually be better in that case. Okay, as this drug, it's called Ermotecan, I think it's pronounced. I could be totally wrong, again, butchering it. That drug is actually metabolized that and has no effect on cancer cells, so it causes the diarrhea. So binding it to activated charcoal is actually the simple solution. Okay, so the metabolite from the drug is what causes the diarrhea, not the mucosal issue that happens with other drugs, if that made sense. So binding that metabolite to the activated charcoal will solve the problem because it removes the metabolite from the system altogether. Okay, again, simple solution. Interestingly, Dr. Paulson, she talks about increasing fiber intake to improve the efficacy of certain chemo drugs. It not only stimulates the immune system, but stimulates the correct flora in the gut. Okay, remember, fiber feeds the probiotics, feeds the good bacteria in your gut. So by doing that, you actually can improve your gut health at the same time. Now, if anything that we talked about today or yesterday about chemotherapy or anything Dr. Paulson, if you will, you can follow her. She's on Instagram and Facebook at Dr. Heather Paulson. Her book is called 7 Natural Ways to Live Cancer-Free. Okay, so she is very much an advocate of natural treatments for cancer therapy, but she is integrative. She uses both chemotherapy and natural options so that you can potentially lower your chemotherapy dosages and have less side effects. Okay, win-win all around. So I know that got a little technical there. I hope my story rings true to somebody here that's listening. If you know somebody suffering from any of the issues that I talked about, tag them, share this post on your page, send it to them on Messenger, any which way, so that they can get information, not just from me, but from Dr. Paulson and some of the other people that I've referred you guys to over the last week or so. So I hope you guys are having an awesome day. I know it's hot, hot, hot here in South Florida. Let me know how it is where you guys are, and hopefully it's a beautiful summer day there as well. You guys have an awesome day. I'll see you tomorrow for another Live in 5.